When people hear the term physical abuse, they instantly imagine actions like hitting or kicking. However, acts of abuse of elders aren't always this obvious. Physical abuse of the elderly is defined as any intentional act or act of omission that presents a risk of bodily harm or injury to an elderly individual. Of course, violent acts such as shoving, hitting, kicking, slapping, pinching, or hair pulling are forms of physical abuse. But other situations constitute physical abuse as well. In a nursing home setting, other forms of physical abuse include using restraints, confining the elderly person to the room or bed, and administering inappropriate medications. Although physical abuse in nursing homes is prevalent, the signs aren't always immediately obvious, especially because the elderly person may be too afraid or ashamed to speak up. The following are clear signs that physical abuse is occurring in nursing homes: bruises, abrasions, welts, lacerations, or rope marks, head trauma or bone fractures, open wounds, cuts, punctures, or untreated injuries in various stages of healing, sprains, dislocations, and internal injuries or bleeding, bite, strangulation, or burn marks or other patterns of injury, signs of falls, including broken eyeglasses or frames, physical indications of punishment such as evidence of physical restraints, medication overdose or chemical restraints, sudden behavioral changes. While these are the most common signs, they're not the only ones to look out for. Physical abuse in nursing homes extends far beyond the pain that the elderly experience. The risk of severe consequences can be high and come in the form of psychosocial consequences, physical trauma, increased hospitalization and mortality rates, depression, anxiety, and a decline in cognitive functioning. Nursing home residents are faced with potential abuse from two different sources: staff members and other residents. Staff members are the most likely suspects if physical abuse is suspected. They are most frequently in contact with the residents and are often alone with them, which means that abuse can occur without witnesses. In a 2020 study conducted by the World Health Organization, more than 64% of nursing home staff members, approximately 2 out of 3 employees, admitted to abusing residents or neglecting them in some form. It's estimated that as many as 5 million elders are abused in nursing homes each year, and the vast majority of cases go unreported. When abuse cases are reported to police, the perpetrator is usually a staff member, although it's unknown how many of these instances go unreported. These statistics are shocking for those with aging family members who need the constant care provided by a nursing home. According to staff members, the leading factor in abuse from nursing home employees is understaffing and undertraining. Because those staff members don't have the tools to properly provide care and patiently handle each situation, they often turn to physical abuse to release their frustrations and force the resident into compliance. Other perpetrators in nursing home abuse cases are the actual residents themselves. These situations can cause just as much physical, mental, and emotional damage as when abuse occurs at the hands of staff members. Some residents may have difficulties expressing themselves constructively and have disagreements with other residents that become heated. This can lead to physical attacks, sexual assaults, and verbal abuse. In these cases, it's crucial for nursing home staff to step in to keep the residents safe. Fortunately, elders and their families don't have to suffer in silence. Although the situation may be difficult to discuss due to embarrassment, shame, or fear of retaliation, you need to take action to ensure your loved one remains safe. Abuse should always be reported immediately. Regardless of which type of abuse you suspect is taking place, no form of abuse is acceptable, and there are resources available to help you and your loved one. Elders deserve a safe and comfortable living environment where they're free to enjoy their lives without fear of physical abuse. If you need help, consider the following suggestions to get your loved one out of harm's way. File a report directly with the nursing facility about the staff member or other resident in question. Seek medical attention for any injuries that the elderly person has suffered as a result of the abuse at a hospital or facility. Contact the police and file a police report. Reach out to Adult Protective Services and express your concern about the nursing home facility. Contact your state's Office of the Administration on Aging, which administers the Long-Term Care Ombudsman Program. Contact a lawyer. Seek other resources that may be needed to help your loved one through the healing process, such as mental health professionals. If you suspect your loved one is experiencing nursing home physical abuse, or you have suffered physical injuries or other trauma due to nursing home physical abuse, contact us for a free case evaluation. By knowing the warning signs of elder abuse, you can help keep vulnerable people safe. If you believe a family member was injured due to elder abuse, maltreatment, or neglect in a nursing home, reach out to us for a free case evaluation. We listen to your concerns and help seniors receive the care they deserve. NursingHomeAbuse.org, exposing nursing home abuse and helping seniors get justice.